Hi, I'm Dr. William B. Rogers, board-certified psychiatrist in Tyler, Texas. Thanks for checking out my website on Medem. I've got a few things I want to pass on in terms of observations and then maybe make some requests for our colleagues in family practice and the primary care specialties. Over the last year, I've seen several veterans from the Iraq and Afghanistan wars. It's interesting how these people found their way to my practice. They were referred not from the VA, but from clergymen, from local family practice physicians, and from Vietnam veterans who knew their families. The Vietnam veteran guys being the ones that are bending over backwards to try to help their younger brothers and sisters. The point I want to get across to you family practitioners and primary care caregivers today is that you're going to be the ones that see these people first. As I interview these people, what we're finding out is that when they're mustered out of the service, be it the Navy, Marines, Army, or Air Force, as they come back to the United States, they want to get home to their loved ones fast. And so they're not telling people on active duty that they're having difficulties, psychological difficulties that later are going to manifest in their home community as post-traumatic stress disorder. So I want you to know something about post-traumatic stress disorder. How are you going to learn about it, and how are you going to learn to recognize it in these young men and women who are coming back home and will be seeing you in your practices? First of all, you have all the resources of my website available to you. There are several places on the site where you can click on articles and informational tables about post-traumatic stress disorder and how it's manifesting in our current veterans. Secondly, you can go to the websites for the VA, and there'll be a link to the VA on my site. And thirdly, there'll be a place on my site that you can click and download a screening form to check symptoms that manifest as post-traumatic stress disorder, and also to look at the things that cause it, the kinds of experiences these active duty soldiers and sailors and Marines may have been having that will later lead to this post-traumatic stress syndrome. Are you going to have to send them to see a psychiatrist? Maybe. Will you send them to the VA? You may try, but even the VA is admitting right now it's hard to handle the masses of people that are going to be coming back, and it takes a long time to get into the VA if they can. Several of the veterans I've treated as an interim measure until they could get into the VA. All the time working to keep them home in the community, keep them at their jobs, keep them adjusting to their families, and keeping them from having to go into a hospital. I asked one of my patients who's a Vietnam veteran, what can we best do to help these younger people coming back? He said, get to them before they start drinking. What that means, of course, is we have to make our interventions before people that are having psychological difficulties start self-medicating. The prognosis for almost total recovery from post-traumatic stress disorder while it's still acute is very good. The prognosis for recovery is much worse if the individual begins self-medicating with alcohol or other substances. And the prognosis for complete recovery is miserable if the individual goes 7 or more years without treatment. The first experience these soldiers, sailors, Marines, and airmen are going to have when they come home is they're going to feel strange, they're going to feel like they don't fit in with their families and friends. They may notice they have a temper problem, especially when it comes to dealing with authority, when authority is not being just or being appropriate with them. They're going to get into these kind of problems, and their families are going to notice they're just not the same. Old friends won't seem the same. The town won't seem the same. That's the point where somebody needs to pick up that there's trouble going on and start doing some supportive interventions. You primary care physicians and caregivers are going to be the first people to see them in your hometowns. These may be patients that you've treated since they were little kids, and they're going to be coming to you with difficulties. And it's going to be somatic stuff like headaches and stomach aches and not sleeping well. The family practice doctor in our town that referred a patient to me was referring him because he was depressed. And indeed he was depressed, but the family doc didn't really make the connection with the combat experiences the fellow was trying to process. Use my website. Use the VA website. Get with your local county medical societies and ask them to design programs of education for you to learn more about how to spot these people and stabilize them while you're getting them referred to the appropriate sources for treatment. We want these people coming back to America, fitting into their homes, happy, healthy, productive, and carrying on with the life they left off before they went overseas for us.